important to remember that not feeling something is not a good thing. That you want to be able to feel. You want to be able to feel pain. When people often have like neuropathy and the pain goes away and they're like, "Oh, good, I don't have any pain." But what they have is numbness, and they've lost the ability to feel. And that's where the danger comes in. That's when people get infections that they don't know about. And because they don't feel anything, they don't feel the pain. So they don't go to the doctor and say, "Why is my foot hurting so much?" Because it doesn't hurt. And we've had people come in with really bad gangrene, and their toes are black, for example, and they're just like they have to be amputated. And we're like, "What the heck? Why did you wait so long to come in?"
Hello, everyone. Welcome to the Fixed Blood Sugar webinar. Coming to you live from Hawaii today. Just kidding. Just Dr. Saunders is. We didn't get invited, but we do need music.
Isn't that amazing that we could like all be in different places and and be on the same program?
That is really cool.
Hawaii, South Dakota. I mean, it just doesn't get much better.
Hey, it is a beautiful day in South Dakota right now, so I will take this day for sure. Where are you guys tuning in from? Let us know. Let us know. It's not like is that how you know you're getting old, when you actually care about the weather? Probably, because I actually do ask about the weather. I think my kids are like, we don't even have a clue. We don't check the weather at all. That's just an older person thing, apparently.
I
But I would
think
like to know.
so. My father-in-law watches the Weather Channel. Uh, and he just like watches the Weather Channel. And I'm like, really? Like people spend all their time watching the weather? Yeah.
It used to be really cool. The Weather Channel I actually used to really enjoy because it would show all these different parts of the world, and
That's
like
true.
it was so fun. And I miss the Travel Channel when it used to do that. Now it's just like haunted, scary shows. And I just want to like, there was a lady, I think we talked about this one time. There was a lady who would travel and just take you with her, and she'd show you all the tourist destinations. I was like, that's my dream job. That is what I want to do. Show people all the cool things everywhere. I miss that. All right, we got a lot of people hopping on. We're already over 100 people. Okay, North Texas, Terry Brown's back in the house. Rayanne is back. Beverly, Texas, very warm. Florida, Fort Hood, North Dakota. Hi, Sue. How are you? Let's see. Maryland, Brenda. We got a Minnesotan, Nancy. Let's see. Joe wants to know what your favorite color is and what your latest hemoglobin A1C trend is. Anne is here. Hello from Texas. Ginger, San Jose, Chicago. We're having sunny. Hello from Chicago. We are having sunny California weather today. Hey, that's great. Look at all these. Montgomery, Michigan, cloudy and hot, 90 degrees here today. Wow. We got Seattle, we got Daytona Beach, San Antonio, Southern California, Cypress, Texas, Tennessee, Livermore, California, Canada, Eastern, another Montgomery, Toronto. Awesome. Hey, Joe, tell us about that. You have a movie recommendation.
Yes, The Unsung Hero. I saw it last night and it was really good. It's like a good family-friendly movie. It's about a story of if you're familiar with Rebecca St. James or For King and Country music group, it's basically their family life story, and it was really good. So I've
Oops,
got a
didn't get to
link.
go see it. You must have just seen it like yesterday.
Yeah, yesterday I did afternoon. So there's a link
Awesome.
to it for more information. Highly recommend. It's bring a tissue or two. I mean, not that I would have
Yeah.
teared up at all, but yeah, it was a good one. It was one of
Hey,
those
that reminds
support
me.
good movies.
The other movie that you saw, it was about the nun, I think.
Oh yeah,
What was that called? Cabrini. Cabrini?
yes,
Cabrini. Yeah, I saw that. That was really good. I enjoyed
yeah,
that.
yeah, that
Okay.
was really good.
2 movies I gotta go see. Okay. All right. So Brenda says my favorite colors are red and white, sorority colors. A1C was 6.5 just yesterday, so not cool. Well, guess what, Brenda? That's why we're here. We're going to talk about these kind of things. So it's okay. You've come to the right place. That's where many people are too. Let's, first of all, Dr. Saunders is here. He's a wonderful doctor, but he is not your doctor. So I just want to put a disclaimer out there that if you would like to implement any of the things that we're talking about today, that you do discuss those with your healthcare provider first. Okay, we're actually going to be talking about neuropathy today, and we want to take your questions, so feel free to post those in the Q&A. And boy, do we ever get a lot of questions about neuropathy. People are either worried about it, they're starting to notice some things, or this is very interesting to me. And so I kind of just want to ask this to Dr. Saunders first. Now, I have heard you tell people that if they start, they've been told they have neuropathy, they're starting the diabetes solution kit, and maybe they're using Nervala, and all of a sudden their neuropathy, or they're starting to get feeling and tingling in their extremities. Why is that maybe an okay thing?
Yeah, we've talked about this. It's kind of important to remember that not feeling something is not a good thing. That you want to be able to feel. You want to be able to feel pain. When people often have like neuropathy and the pain goes away, and they're like, "Oh, good, I don't have any pain." But what they have is numbness, and they've lost the ability to feel. And that's where the danger comes in. That's when people get infections that they don't know about. And because they don't feel anything, they don't feel the pain. So they don't go to the doctor and say, why is my foot hurting so much? Because it doesn't hurt. And we've had people come in with really bad gangrene, and their toes are black, for example, and they're just like, they have to be amputated. And we're like, what the heck? Why did you wait so long to come in? And they go, it didn't hurt. So that it didn't hurt is not a good thing necessarily. Like everybody thinks that it's okay. It's kind of like, your teeth. If you have have an abscess in your tooth, but the nerve is dead, that's not a good thing to keep an abscess around. It's not good. So you want to be able to feel pain. You want that. So that's why, you start taking Nervala and people start getting numbness and tingling, start getting tingling and burning sensations. And when they walk on it, they'll get pins and needles and they'll go, this Nervala is horrible. It's making me have all this nerve pain. And I'm like, yeah, that's a good thing. That means the feeling is coming back. And then you want that feeling to come back, and you have to tolerate those pins and needles for a while. It's kind of like, have you ever slept on your hand? You slept on your arm, and you wake up in the morning and it's completely numb. And you go as the feeling comes back into it, and it's all pins and needles. Well, that would be a hard thing to deal with for days and weeks and months. And that's kind of what a lot of people deal with neuropathy. But with the Nervala and the exercise and the blood sugar going down and doing the program, it eventually comes back to normal, and that those pins and needles go away.
Okay, so what is it again that is actually happening in the body though? When, or what makes neuropathy develop?
Well, the nerves have gone to sleep because they can't transmit an impulse. So they still exist. They just don't have enough energy to transmit an impulse, so they're not working. And so what the Nervala is doing is waking them up. They're starting to function again, and they're transmitting impulses. And at first, it's all random stuff, and so it makes you interpret. Your brain is interpreting that as pins and needles. But that waking up is the sensation that you're getting, because when you have diabetes type 2, there's a couple of things that are going on. One is that you get less glucose through the blood-brain barrier into the nerve cells for the nerves to function. So the nerves don't have as much energy because of not enough glucose. But there's another problem, and that is a lack of circulation. And it's not the circulation in the big blood vessels, although that does become a problem too. It's circulation in the tiny, tiny blood vessels, the little teeny capillaries, the micro vessels that you can't see with your bare eyes, that don't allow blood to get through. I mean, think about it. The blood has to go through these vessels that are so tiny that you could barely get water through them, and the blood has to go through there. And when they're messed up and swollen, and the lining that isn't being made, the lining, remember, called the glycocalyx, that is like a super slippery film that allows the blood to flow through there. When you're not making that, then the blood just doesn't flow. It's sluggish. So you're not getting oxygen, you're not getting nutrients, you're not getting vitamins. You're not getting glucose. I mean, it's kind of weird when you think about it. Your cells are swimming in glucose, but you can't get any to those nerve cells inside the nerve cells to cross the blood-brain barrier, because insulin resistance is another reason for that. But yeah, here's the glycocalyx. This is so cool. I mean, if you don't believe in God, you gotta believe in God. If you even just look at how a blood vessel works, it is so amazing.
Oh,
So
picture, but
on a normal tube, well, you saw that little hairy part on there. That's the glycocalyx. It's kind of like fur. You look at this one down here. I can't point to it. It looks kind of like fur under a microscope. And so it's like a cat. That's why I always describe it as like, a cat's fur. And what it does is it allows the blood to go through without any resistance. So it's like greasing the sides of the blood vessels, allowing everything to just flow through there. So in a normal pipe, you have what's called laminar flow. And what that means is in the middle, you have fast flowing water. And on the outside, because there's resistance on the edge of the pipe, it's slow flowing. So it flows really slowly against the pipe, and then a little faster, a little faster, a little faster. And the super fast water is going right through the middle. It's called laminar flow. Blood vessels don't have that. It flows, all of it, all the way through because of that glycocalyx. So if you're not making the glycocalyx, guess what? You don't have good flow. And if you don't have good flow, you're not getting nutrients to those cells that need them. So that's where it gets, especially like in the feet, you get neuropathy, but it happens in the brain too. I mean, it's not just down below, it's up above.
So what do we do about it? What do you recommend for someone who's noticing that they're dealing with neuropathy?
First thing to do is get the blood sugar under control. So phase 1 of the program is like the most important thing. People think they're gonna pop a pill and fix everything. That's not the way things get fixed. It really needs to reverse that insulin resistance. And so what you want is more insulin sensitivity. And the way you get insulin sensitivity is by avoiding glucose, avoiding sugars, avoiding starches, and making sure that you, or not eating periodically. Fasting is a great way to get insulin sensitivity. Because you want to clean out all of that glucose that's stocked up in your cells. Just your cells are jam-packed with glucose, and you got to use that all up. So exercise is a great way to get insulin sensitivity. So doing all of those things is the first line. And then we also have Nervala. Nervala has 2 nutrients in it. One is alpha lipoic acid, and the other one is benfotiamine. Benfotiamine is a B vitamin, vitamin B1. It's a fat-soluble vitamin B1 that can go directly into the cells. And that's why it works right in the blood vessels, because from the blood, it can go right into the cells wherever there's damage to the glycocalyx. So the glycocalyx will protect the things don't go into the endothelium from the blood where there's glycocalyx, but wherever it's damaged, that's where this benfotiamine can get into the cell and actually help the cell to heal. So that's one. And the other one, alpha lipoic acid, helps the nerves by decreasing inflammation and improving antioxidant potential for the mitochondria to make more energy.
All right. And I want to show, hopefully this will show up on my screen. I just want to show you where the diabetes solution kit is. So if you hear us talk about phase 1, 2, 3, we're talking about different phases within this diabetes solution kit here. So it's a very small book. You can get the downloadable version today, or you can get the hard copy. But very simple. It's a very simple program, but you're going to have to commit to it. And you can also get this for 25% off. So if you go to bartonwebinar.com, use code webinar25, one word, webinar25, you'll save 25% on either that Nervala or the diabetes solution kit. And I'd love to hear from you guys in the chat if you are using the diabetes solution kit or Nervala. Let us know. Let us know what phase you're on in the diabetes solution kit. And we have some really good questions that are coming in. And so I'm going to actually jump into some of those, I think. I want to find this one here. Let me see. Okay, really good question. A few different people have chimed in on this. So Brenda said, I can't tell if my glucose level is too high or low without checking a monitor. What are some signals that your body will give you if your blood glucose is too high or too low?
Okay, that's great that you've noticed that, because that's kind of important. The being too high doesn't have any symptoms until you get really high and you start urinating frequently. Some people really feel bad, but usually they feel bad because they're sick or something, and then they also get really high. So most people don't feel bad because the blood sugar's high. I've had people, in the 300s for a long time with no issues at all. Urinating frequently or getting up at night a bunch of times is what the word diabetes means. Diabetes is definition is peeing too much. That's what we call diuresis or diuretic.
Interesting. Okay. Elliot said, he had asked that same question. Okay. And then someone else said something about their appetite. They noticed they had a lack of real appetite, apparently, when the levels got too high or too low, which I thought was interesting.
Oh, yeah, that's possible. Yeah, when it's too low, you release a whole bunch of cortisol, stress hormone, that makes you insulin resistant and tells your glucagon to make more, your liver to make more sugar, more glucose, and so that raises the glucose pretty quickly. So a lot of people they'll feel like palpitations, anxiety. Some people get headaches when it's too low, fatigue, weakness.
Okay. All right. Paul says I've been in phase 1 for 4 months and I have my blood sugar down to a 30-day average of 108. My A1C is 5.9, coming from 6.8.
Wow, good for you.
Paul says I stopped my metformin and Jardiance immediately, and my statin, when I heard you say that below 200 on a total cholesterol is too low. Mine was 95. Now it's 178. What should I do to get it and my LDL down?
To get the LDL, well, you don't need to get your LDL down. Don't even look at LDL. It's a non-issue. When they put a whole bunch of data into the computers in England, and they looked at 450,000 people, they put all their data into a computer and said, what causes heart disease? LDL was like way down for number 46 out of 48. It was really a nothing. It's not even an issue. Whereas your total cholesterol, ideally people live the longest if it's around 220, to 210 to 240 kind of thing. That range is an optimum place to be as far as longevity goes. But I an issue with people being 190 or whatever total cholesterol, that's okay. You don't have to raise it. I don't think. I don't know of any research on that.
Right. Jim says, should you eat foods in a certain order?
Oh, that's a good question. I don't know, but I've been discussing this topic recently. I was talking to my brother about this. That when you eat sugar, glucose, you process it and bring it in and use it up and bring it into cells pretty quickly. I mean, if you look at you eat, blood sugar goes up and it goes down, and we're talking a couple of hours, a few hours. Whereas if you eat fat, you get insulin resistance that lasts for 8 hours. It just keeps going and going. So, if you eat fat first, you're going to be insulin resistant. So if you eat in a manner of you eat whatever has glucose in it, and that would be like starches, like I don't know, rice or corn or beans or whatever, all of the starchy stuff that has sugar in it, glucose. You eat that first, and then you have whatever has fat in it later. Then that might be better than the other way around, because if you eat the fat first, you're going to be insulin resistant right away, and not be able to use that glucose, whatever's in there. That's a theory. I mean, it's a real thing that fat does make you insulin resistant, and prevents you from using glucose. So. I don't know that you have to eat in that order, but it just seems that way.
Interesting. Yes. Okay. And Rose said, what is it when I have what feels like needles pricking my toes?
Yeah, that's the neuropathy. If it's only on one side, then that's a neuropathy for a different reason. That might be the injury of a nerve of some kind. Some kind of injury or damage or a pinched nerve or something like that, if it's only one side. But if you have it on both sides, that's a systemic problem. That's a problem with your whole system. That means it could be like diabetic neuropathy, that sense of feeling of pins and needles. Yeah.
All right. Anonymous said, is there some kind of feedback I can get from my mitochondria making more energy so I can stop my AFib drug, sotol. How do you say it?
Sotalol.
All right. I've heard you say it. I should be recording the way you say these. I'm scared to stop it.
Okay. So think of the sotalol as just all it does is slow down your heart, nothing else. It doesn't fix the problem. In fact, in over a long period of time, it makes your heart weak. So it's not really a good long-term medication. So in the immediate sense, because it slows down the heart, it can either, number one, stop you from going in atrial fibrillation, or number two, when you're in atrial fibrillation, instead of having a rapid response, you're going to have a slower response, which allows better filling time, allows the heart to be more efficient. So there are reasons for taking sotalol. So your question is, how do you know if you're making enough mitochondria so you don't need sotalol anymore? And the answer is, well, when you no longer have atrial fibrillation and your heart rate is normal. So and usually what that means is if you're taking sotalol and your heart rate is too low, so something like you're beating in the 40s or something like that. I had actually a case of this woman. She's in her 80s, and she was given a beta blocker, a different beta blocker, metoprolol. And her heart rate was in the 30s and 40s. And when she stood up, she would get dizzy and fall down. And she lives alone. And I'm like, no, that's dangerous. You live alone. You cannot take that drug because you're going to fall, hurt yourself, and there's no one around. So she went off the drug and she got better. And then she went back to the cardiologist. And the cardiologist said, oh, we'll just put you on a different beta blocker. and put her back on a beta blocker. And the same thing happened. She went home and she started getting dizzy again. And so I said, okay, so go off the medication and measure your blood pressure morning and night. And in the morning, she had a blood pressure that was 150s, 160s, systolic. But at night, it was always like 117, 120. So it was getting low at night, and that's what's happening. So she goes into the doctor and she has on the high side, and he goes, "Oh, you need this." And then she goes home and her blood pressure comes down to normal, but now with the sotalol, it's dropping too low, or metoprolol dropping too low, and she's passing out. So we figured out what the problem was. But man, you got to be careful with that stuff.
Right, good question. Mirabella says, once blood sugar levels stabilize, would it hurt to continue using synochroma, as I also depend on D3, K2, and selenium? Or is there another source that I can get them from?
Thank you for asking that. Almost everyone on our team, including me, we take synochroma on a regular basis. I don't take it every day, but I totally agree, because it's not easy to find a vitamin D supplement that has enough in it. Most of them are like, 800 milligrams, 400 milligrams. It's like, okay, that's not enough to get you into the normal range, right? You need like 5,000 to 10,000 to get you in the normal range. So yeah, no, you can keep taking it. It's a supplement, just like a supplement. It's not like a drug that's gonna, lower your blood sugar or anything like that.
So where would you get selenium from if you wanted to get it other than in a supplement form?
Well, I think the only good source is Brazil nuts. Brazil nuts, and not because there's anything magical about the nuts, it's just because they have to be grown in a certain area of the world, and that area happens to have a lot of selenium in the soil. So you get a lot of selenium in the Brazil nuts. And, one Brazil nut is enough. If you just ate one a day, or three or four or five a week or something, you'd get plenty of selenium.
All right. Anonymous said everything's heading in a positive direction on phase 1, but my insulin score went from 13.8 to 14.1. What am I doing wrong?
Okay, 13.8. If that's both fasting, that's a little on the high side. It should be below 10, ideally around 5. The optimum is around 5. So 13 is a high, but 13.8 and 14.1 are the same number to the laboratory. So if the laboratory came up, if they took one blood sample and did it twice, they could easily do 13.8 on one and 14.1 on the other one. So there's not enough difference there to say it did not go. In other words, my point is, it seems like 14.1 is higher than 13.8, but it's not. So by laboratory standards, it's not. It's just fine. It's the exact same number as far as the laboratory goes. So having said that, and the fact that you're doing so well, but the insulin didn't go down, that's where being persistent and patient, and where am I going wrong? Well, okay, so here's what causes you to release insulin. Every time you eat. So if you eat fewer times, you make less insulin. Every time you eat carbs. So if you eat less carbs, you'll make less insulin, and that's where our program comes in, right? Every time you eat protein. So some people, they go on to our 20-gram or less carbohydrate diet, and then they go on to a super high protein diet where they're eating like carnivore, and they're eating 120 grams of protein a day, 40 grams per meal, 3 meals. Protein will also cause the release of insulin. Insulin, we think of it as only a sugar thing. It's not. It also gets amino acids into your cells. And so when you're eating protein, you're going to make insulin as well. So it's not a simple one-to-one thing. Some people really react to it more than others. I've had some people who make more insulin with protein than they do with carbs. It's really funny with starch. So so getting insulin down means eating fewer times, eating less carbohydrates, and maybe eating less protein.
I love this. I don't love this story, but the story that you tell about how stress also can affect things. And I know Dr. Saunders has shared the story about a lady who couldn't figure out why her numbers were not improving, and then her daughter moved out, and magically her numbers went down. And so there's always the stress factor as well too that I think is good to just be aware of.
Yeah, that's important.
That doesn't happen for my kids. I hope that doesn't happen, but we'll see. Okay. Good question here. Anonymous says, how high can your A1C level go? What is the range?
Well, I mean, there's an optimum range, and if it's below 4, then you're probably that's hypoglycemic. So it would have to be, above 4, I don't know, 4.5. And how high can it go? Well, I've seen 13, 14, 17, I remember. Yeah, so 17 is something like your average blood sugar is in the 400s or something like that. It's really high. Yeah, I don't know. And then the optimum range, consider it's really narrow. It's like 5.0 to 5.4. That's that optimum range. If you're in Canada, the hemoglobin A1C stays the same. That's 5.0 to 5.4. Your blood sugar would be different. So your average blood sugar at 5.0 to 5.4, your average blood sugar is going to be between 4 and 5.
Okay. Tanya said if my sugar is high, for example, 126 before a meal and 245 1 hour after I finished eating, and 156 2 hours after I eat, and then back to 124 hours after I finish my meal. Is anything getting through the blood barrier?
Oh, the blood-brain barrier. Well, we don't know if it's getting through the blood-brain barrier, but obviously it's getting into your cells. It's taking a few hours to do so. So your insulin is working. It's just taking a long time to work. So that's an indication of insulin resistance.
Tammy says, how can I tell how many receptors I have and how well the few that I have are working?
You're getting on my nerve. You're getting on my last nerve. Okay. So how many receptors do you have? Well, you got millions of them. And then the best way to tell that is how much insulin resistance you have. So if your insulin levels are high, then you have a lot of insulin receptors that are not working. Or you're not making very many of them. Either way, it doesn't matter. Either way, it's not working. So that's what insulin resistance is. You have the cells that are making receptors on them for insulin. And if they stop making receptors for insulin, then the insulin's going around, has nowhere to bind. And so it stays in the blood, circulates.
Okay. Let's see. Anne said my favorite color is green and my A1C is 5.0.
Wow, 5.0. Very good. So, okay, so that's kind of an optimum. That's a really good place to be in that narrow range. 5.0, that's as normal as you can get. That's optimum.
Allison said my A1C was 6.5 in December. May 6, it is 5.9.
Wow. So in 6 months, you came down from 6.5 to 5.9. Wow. Very good. Good work. That's really good.
All right.
That's exciting.
Sue wants to know how long for the nerves to reset.
Okay. That is a great question. And I didn't address that at all. So thank you for asking that. Nerves are slow. Dang, they're slow. They take a long time sometimes. People that have strokes, they can get better right away if the blood just comes in right away. and heals pretty quickly. But if they're without oxygen for a longer period of time, it can take months before they start seeing improvement. And then after that, wherever the nerves are dead, they have to work and work and work and work to see more improvement. And it could be years. So just depending on how much damage there is, the nerves, we've had people write into us and said, I started taking Nervala, and 1 week later, I was like all better. My neuropathy in the feet went away. I'm sleeping all night long. It was great. What, a week? That's weird. That's weird because that's really fast. Whereas most people are like, I mean, the research, they did 6 months. When we looked at the research for both the benfotiamine and alpha lipoic acid, they're talking, they don't even report back for 6 months. So, and they saw significant differences, but not in a week or a month. It was quite a long time. You're muted.
Rose wants to know, how do you not get sick while fasting?
Okay. So getting sick while fasting, think about it. Why would you get sick while you're fasting? You're not eating anything. You're not putting anything in that's causing damage. What the heck? How do you get sick? Okay, here's what happens. When your stomach is empty and you're going like, man, I need some food in my stomach. Especially if you're making acid, then there's no food in there. And you're making ghrelin and you're hungry. And then your blood sugar drops low, right? That's the kicker right there. Your blood sugar drops low because you haven't eaten anything and you're not absorbing any sugar. And you're insulin resistant. So then you're fasting and your blood sugar is getting lower and lower and your energy is going away and you get a headache and you get nausea and you feel dizzy and just life sucks, right? Because you're fasting. How do you not get that? Well, you know what? You just got to get it and push through it. And, I've often told the story when I was fasting one time, and I was only like 1 day fasting. And it was only after 1 day of not eating. And I was giving a presentation to like 100 people. I passed out in the middle of the presentation. I was like, oh. Like, okay, I'm okay. I got up right away.
Wow.
I like that story. I mean, it's not, but it makes me able to fast when I think about that. Oh, did we just lose Dr. Saunders?
He's playing be as still as he possibly can. He's doing really well at it.
Well, I'm
Frozen.
still a doctor, so I'll have to answer all these questions, I guess. Just kidding.
Sure.
Actually, you know what? So Mary said, I received an email about the master class you teach. What is that about? And should I get that? Maybe Joe, you can help me with this, but I think Dr. Saunders recorded quite a few videos for the master class, and you can get access to that, all of his teachings.
Yeah, there's just some extra videos that he's done in the past. It's includes the diabetes solution kit as well. Yeah. I think it's just a different marketing page that we had set up, so we called it the masterclass because it included the videos. So, but honestly, like the diabetes solution kit and these webinars is going to be a lot more comprehensive. So, and you still get access to all of it. I think the price is the same. So either way, it's basically the same thing.
All right.
Mm-hmm.
Okay, let me see. I know there's a question that asks if Nervala cures something, and I'll just tell you right now that we can't say if it did or didn't because it's an illegal word for us to use because they'll block this video. So I'll have to let Dr. Saunders talk about that a little bit. Let's see. Anything else that I can actually answer? Andrew says, I'd like to thank Barton Nutrition for helping me lower my sugar level in my urine. I started taking Cinachroma and turmeric BP since March 18th of this year. I take it twice a day. I use diastics to test my urine. I was 28 millimoles per liter. Learned that from Dr. Saunders. But now it's negative. All this within 6 weeks. However, I still have sciatic pain on my left leg. Okay, so I'm going to let Dr. Saunders answer that second part, but that is still amazing, Andrew, Thank you for sharing that. I'm going to share that with the team. Hopefully Dr. Saunders can hop back on and we'll have him answer the rest of that. Quick share this. All right, what else? So the Cinechroma will work for both insulin deficiency and insulin resistance. How so, Frank? I think we'll let Dr. Saunders talk to you about that, but I think you would definitely recommend using the diabetes solution kit to help with those, which is that book that we showed at the beginning of the webinar. Where do you go to get your insulin tested? What doctors can you go to monitor all this stuff? So a lot of people check their blood sugars at home, and the other testing, yeah, we have a lot of people that like to find functional medicine doctors in their area. And you can usually Google that and find those types of doctors, but any doctor can check your insulin level. Lori, in case Dr. Saunders doesn't come back on, you had asked, why does my blood glucose level go up in the morning when I haven't had any food? He actually answers that question at bartonwebinar.com. That's one of our top asked questions. And I would recommend that you go there. He'll answer that for you. bartonwebinar.com. Why shouldn't people in phase 1 take fiber greens? Dr. Saunders is not a big fan of people using any form of sweetener when they are first using the diabetes solution kit. And although many people say, but stevia is natural, true, but for some people, their bodies respond to it like it is sugar. And so he just recommends that you don't use it in phase 1 until you know how your body responds to it. Okay. I have 14 bottles of Cinechroma en route. Is that the same as phase 1 or the diabetes solution kit? No. Cinechroma and the diabetes solution kit used together will be a really good option for you, though. The diabetes solution kit you can get for under $20 right now. You can go to bartonwebinar.com and that will help. Oh, I think he's coming back.
You went out for a quick surf?
Let's see.
Still muted.
Did you miss me?
There he is.
Leslie did great filling in for you. Way to go, Leslie.
All dollar problems.
She could answer all the questions. She's heard them all.
Let's see. Okay, let's do this. Michelle said, I have been on ALA for years. Alpha-lipoic acid, I'm assuming.
Yes, probably.
Okay, I take Norvala. I have numbness in toes, feet, and hands. I exercise, eat close to phase 1, and am pre-diabetic, but A1C is increasing. Yikes.
Okay, so that might be an issue as far as that goes. The neuropathy is often due to the insulin resistance. So if your insulin is increasing, your insulin resistance is increasing. So just that's what I meant at first. The supplements are not the answer. They help regenerate and repair, but if you don't fix the underlying problem that caused it in the first place, then it's not going to get better. So what you need is to do phase 1 of the program and get your insulin sensitivity up so that you can get glucose into the cells and the nerve cells, and so your nerves can function normally.
All right. Okay. Does Nervala cure symptoms of brain fog or dementia?
Probably not. The way it works is very different from that. Brain fog or dementia, the first thing you have to do is get glucose into the brain. So that's where the number 1 cause of dementia in the world right now is insulin resistance. And the reason for that is because you make fewer insulin receptors, and sugar can't cross the blood-brain barrier, and parts of your brain are very sensitive to glucose levels. And if you don't get enough glucose, they just stop working. And your brain will actually shrink down. And so that brain shrinkage is a marker for diabetic or insulin resistance type problems. So the way to handle that is to get your insulin sensitivity up. And that's with all the things we talked about. Do phase 1 of the program, start the program. Exercise. The more you exercise, the better able your cells are to bring in glucose and the more insulin receptors you'll make for the blood-brain barrier. And fasting periodically. Those are the best things to do.
Anonymous says, over the past 2 years, I've lost 91 pounds and I feel fabulous.
Wow. Wow. Yeah. How did you lose 91 pounds? That's what I want to know. Is it phase 1? We can take credit for that.
It says, but my A1C level is still 12.2. How can I feel so great if my A1C level is so high?
It's just because your average glucose is high. Yeah, that's why blood sugar is not the best measurement. It's just the easiest measurement. It's not the best way to look at it, but it is the easiest. Okay, so it's not about weight necessarily. We often think and we often say, oh, if you would just lose weight, you wouldn't have that issue. But that's not really the case. Losing weight is not the issue. It's insulin resistance. And so you can lose weight by not eating and or by eating small amounts and still have insulin resistance. So for example, there was this program, the doctor's program, where they gave you the food, like this is all you can eat. Here's your box of food for the week. And this is, day 1, this is your food, day 2. And it was all spelled out, and that's all you would eat. You didn't have to buy any other food. And that's all it was. It was 500 calories a day. And there was no sugar in there. Everything was artificial sweeteners, the sweet stuff. They had the shakes, and they have protein in them. So you're getting, so everything is the right amount of everything. But a lot of it was sweet, like the shakes and the bars and all that stuff, with artificial sweeteners, so that they wouldn't have calories. Well, so because people were eating 500 calories a day, they actually lost weight, but their insulin resistance did not go down. And so when they stopped the program, they gained back +4 in the studies. So they gained it all back +4. Why +4? Well, it was an average of 4 pounds more that people had on them after doing this program that was recommended by doctors. It was like you had to go to a clinic to get it done, kind of thing. So the point is to lower insulin resistance, and often that means avoiding artificial sweeteners. Yeah, eating less calories, you can lose weight and still be insulin resistant. And see, that's what's happening. If you guys have heard about the what is it? The injection that you can use,
Ozempic.
Mounjaro, Ozempic, yeah, the peptide injections. Everybody's like, wow, that's great, that's great. You guys, it's all marketing. It's all marketing. And in a few years, after they've made their billions of dollars, they're going to say, oh, actually, that's not very good. Why? Well, because when you're taking the injections, you're increasing insulin, you're making more insulin resistance while you're losing weight. And yeah, people are losing weight. Yeah, I've lost 30 pounds, I've lost 50 pounds, but you're getting more insulin resistance. It's not a long-term solution. It's a short-term solution for a long-term problem.
Okay, let's see here. Oh, I did read this part of this. Okay, Andrew said, I'd like to thank Barton Nutrition for helping me lower my sugar level in my urine. I started taking Cinachroma and turmeric BP since March of this year. I take it twice a day. I use Diastics to test my urine. It was 28 millimoles per liter, but now it's negative. All this within 6 weeks. However, I still have sciatic pain in my left leg. Is it because there's still old sugar in my blood vessels, or are my nerves damaged and it takes time to repair?
Wow. Okay. That's great that you no longer have sugar in the urine. because if sugar is spilling in the urine, that usually means it's pretty high in the blood, right? It has to be over 200 generally, but most people it'll be 250 to 300 before they'll get spilling urine, still spilling blood sugar, the sugar from the blood spilling into the urine. So the fact that you no longer have any glucose in the urine is a very good thing, and that's great. But the sciatic pain is probably not related to the blood sugar, and it's probably not even a diabetic neuropathy. That's a different type of neuropathy. Like I was saying before, if you have it only on one side, like sciatic pain or something like that on one side, that's generally not from a circulation problem or a blood sugar problem. That's from a pinched nerve. There's some kind of physical aspect of something that is pinching or pushing against or injuring the nerve, the sciatic nerve specifically. While I think it's really important to continue your quest for normal blood sugar, and it's a great idea, continue that. But don't assume that it's going to fix all your problems. You still need to find out why the sciatic pain is there and fix that separately.
Oh man, we're running out of time and there's so many questions. Okay.
So many questions, so little time.
I know, and I'm wasting time by reading through them. Okay. Frank says, so the synochroma will work for both insulin deficiency and insulin resistance. How so?
Okay. Maybe. It doesn't always work that way, but yes, if you have insulin deficiency, and you're not making enough insulin, and so you eat, your blood sugar goes up too much. If you are more insulin sensitive, then that small amount of insulin that you make could help you use that sugar more efficiently, and so bring it into your cells better. And that would then help you to have a lower blood sugar. So your glucose would be more normal with the synochroma. So that would be insulin deficiency. Insulin resistance is where you have insulin and you may have a lot of it, but it's not working. And so the synochroma has several things in it that make you more insulin sensitive. So if you're deficient in vitamin D and you take vitamin D, you will be more insulin sensitive. If you're deficient in chromium and you take chromium, you'll be more insulin sensitive. So, and selenium and vanadium. So the nutrients in the synochroma are to help you to be more insulin sensitive. So that's why it could work, in different ways for both of those issues.
Okay. Oh, and Anonymous did say that they are on phase 1, and that is how they lost 91 pounds.
Oh, good work.
I know. Awesome.
I love that. I love that.
All right. Pam says, where do you go to get your insulin tested, and what doctors can you go to monitor all this stuff?
Okay. Find a functional medicine doctor. They're all over the place now. So when I first started functional medicine, I would go to conferences and there would be 100 or 200 people there at the conference. Doctors who are learning how to do functional medicine. Now I go to conferences and there's thousands, 5,000, 6,000, 7,000, thousands from all over the country. So wherever you live, you'll be able to find a functional medicine doctor to help you with that. And actually do the proper testing so that you can know what your insulin resistance is and how to handle that problem.
I just thought of a really fun webinar where I go through and try to answer all the questions, and then Dr. Saunders comes in and tries to answer the questions. See, I answered that one correctly, right? Find a functional medicine. All right.
Yeah.
Okay. Allison says, if you have ulcers, fasting makes the ulcer flare. So only fast if you don't have ulcers?
Okay. What would I do as someone who had peptic ulcer disease? And because you know, if you're making acid, and you're not eating, then the acid is just, you know, eating away your stomach lining. And so that's a hard thing to deal with. And why would you be making acid? Well, there's a reason, and generally you only make acid when you're eating. So find out why you have ulcers. There's got to be a reason why. Do you have a Helicobacter pylori infection, or some other gastritis? Is it from alcohol, or is it something you're eating that you're sensitive to or allergic to? And so finding out why you have ulcers and getting rid of that. I've had people who've had ulcers because they have allergies, and their allergies cause them to make more histamine, and histamine tells your stomach to make more acid. And so just because they had allergies, they were making more histamine, their stomach's making more acid, and they're getting ulcers. Looking at why you have the ulcers in the first place is a good thing anyway. You need to know that so you can fix that problem, and then you can fast as much as you want.
I want to quick mention this. Of course, we're out of time. Darn it. Okay. You know what? I can do this when we're done. Dr. Saunders,
Well,
thank you.
I'm on vacation. We can go as long as we want.
Vacation. Okay,
I don't
awesome.
have a patient.
Well, I just want to mention this. Okay. I mean, he's on vacation, guys. So you guys got a couple more hours. You all good? Okay. Rayanne did say requestatest.com. Thank you, Rayanne, for that. I feel like you're always there to give us the things that we can't remember. So thank you. You know what? All right, let's see. I got to put this in my notes, or I'm going to forget this, and someone's going to ask. How many times? How many times have we gotten the name of that?
Yeah. Some states don't allow that. Some states, I don't know, maybe request a test. Maybe they have a doctor that can prescribe it. I don't know.
Allie says, great video, really enjoyed it. Thank you. Debbie wants to know, when you fast, do you only drink water?
Yes. When you fast, the optimum is to drink only water, and then even that, limit it to like a couple times a day. So if you have 16 ounces twice a day, that's about meeting your needs, so to speak. The mistake people make is when they're fasting and they're eating all the time. Remember, every time you eat, you're making insulin. And then they say, well, I'll just drink water. And they're constantly sipping water all day long. And that's depleting them of good minerals. And every time you put something in your stomach, you stop making ghrelin. Ghrelin is the hunger hormone. And so, okay, great, you're not hungry, but you also don't get the benefits of ghrelin to repair your body and fix all your nerves and all the issues with your body. So you want the ghrelin. So if you want the greatest benefit from fasting, it is nothing, no food, no water. And that's pretty much what the animal research shows. Now, human beings, they don't do that research, right? For good reasons. So yeah, but I always drink water, and if I have water, a couple times a day, I'll drink 16 ounces twice a day just to make sure I stay hydrated.
Mercedes wants to know if we have any specials on Synachroma. Yes, we do. Use code webinar25 to save 25%. And you can go to bartonwebinar.com to find that. I'm trying to think. You know what? I think I posted that in the chat. Maybe I didn't, but I will do it again. All right. Did that one already. What role do plaques play in dementia? Is it only the blood-brain barrier that's the problem?
Yeah, plaques probably don't play a lot in dementia. Wow, that could be a tongue twister. Because that's not the primary issue. I have people with like a whole bunch of plaque in their arteries. Their carotid arteries are down to like 70% blocked, and the brain's working fine. So that's not the issue. Usually the issue is damage to the microvessels, the small blood vessels, something called multi-infarct dementia, where you're getting a whole bunch of the little blood vessels in the brain are getting blocked off. That's small vessel disease. That's a problem with dementia. or the other part is the blood-brain barrier, the sugar. So what we're talking about here is a specific kind of dementia that's a metabolic problem of not getting enough glucose into the brain because the sugar can't cross the blood-brain barrier and get through into the brain. And that's the kind of dementia we're talking about here. Yeah, there are a lot of other kinds of dementia, but this is the one we're thinking of here.
Okay, last question. What is the difference between synochroma and berberine, and what is the best way? This is two questions. What's the best way to change insulin resistance?
Okay, I'm going to take the first one first, and that is because the most important thing you do is to change insulin resistance. It's really not about blood sugar. That's our secondary measurement. And it's not about fat. That's our tertiary measurement. Our primary thing is insulin resistance. So yes, I recommend everybody get an insulin test. Find out what your insulin is on a fasting specimen. If it's really low, and do the C-peptide, because that tells you how your pancreas is working with the insulin, how much insulin is more of a long-term sort of thing. So, and the way to think of insulin resistance then is what causes you to make insulin, and why would you make too much insulin? Well, you're making too much insulin when you're doing stuff that makes insulin too much. So remember that type 2 is toxicity, and you're toxic on what? Glucose, sugar. So it's really simple, and that is cut out glucose. So the diet that we have is have a 20-gram carbohydrate diet. And that's not a lot. That's like one slice of bread. That's it for the whole day. That's all you get. Everything else has to be vegetables. There's a lot of free foods, right? You can have all the spinach and cabbage and broccoli and cauliflower, celery. You can have all that you want, all the salad you want. You just, yeah, all that. But you're very limited as to how many glucose carbs you could eat. So that's one way, is to not eat glucose. Another way to improve insulin resistance is to exercise. And it's one of those more is better kind of things. It's yes, you can do too much, but you probably wouldn't. None of you are going to do a triathlon, right? So the exercise allows your cells, your muscle cells, to bring glucose into them without needing insulin. So you can actually improve insulin sensitivity with only exercise, even if, like, let's say you had type 1 diabetes, where you don't make any insulin at all. With exercise, you could bring glucose into your muscle cells without having to have any insulin. So you could improve your length of life even if you didn't have any insulin to inject, just by exercising. So low glucose diet, exercise regularly, and then fasting. Every time you eat, you release insulin. So people who are snacking all day long, chewing on gum, putting things in their mouth, whatever it is, they're eating stuff. Every time you're eating something, drinking drinks all day long, and they just put a little squeeze of lemon with some sugar in there or something. Doing that every time you take a sip, you're going to release insulin. So you get insulin on top of insulin on top of insulin on top of insulin, and you just keep adding onto it. So don't put anything in your mouth. And that may mean fasting for a period of time. I had somebody recently do 72 hours, and he's like, was really surprised that the first day he's hadn't eaten in a whole day. His blood sugar was high. It was in the 200s. And I'm like, it's okay. Don't worry. Just keep going. He was worried. But by the third day, he was down to normal. He was 88. So, it can take that amount of time to do it, to improve your insulin sensitivity. So those are the three primary things. Now back to the first part of your question. What was it?
Synochroma and berberine. What is
the synochroma. Okay, so we might have made synochroma with berberine in it. We might have done that. I don't remember that we were looking at it at that point, but But we didn't. And the reason is because berberine has a lot of uses. It's not just for diabetes. And yes, it helps insulin sensitivity the same way metformin does, but it also can be used for longevity. It can be used for heart disease. It can be used for cancer. There are so many uses for berberine that we don't want to put it in synochroma. We want you to take both synochroma and berberine if you want to do that kind of thing. But so they can be taken together. That's the point. They have no interactions, no problems taking them together. It's just fine.
There you go. You can find those at bartonwebinar.com. Use code webinar25 to save 25%. Okay, that's it. You guys, thanks for being around us. Dr. Saunders, thank you for taking time away from your vacation to answer all these.
Hasta mañana.
Aloha.
Yeah.
Aloha.
Hey, I know some German. Tschüss. I think that means bye.
Ooh, haven't used that one for a while.
Auf Wiedersehen.
Auf Wiedersehen.
Oh, it's just us. He's gone. All right, we'll see you later.
Bye.
Bye.